Thank you. Mr. Russell, once more, man, how impressive is that? I feel like you're the LeBron James of secondary and primary school teaching. So just hats off to you. That said, um, Dr. Goldhammer, um, okay, you say that 5 months is the average for children with dyslexia versus an average of 2 months for all students. What if you just compare students who are lower socioeconomic class versus higher socioeconomic class? What is the difference in math progression in that spread, if you will?
Well, actually, the comparison was not for students with dyslexia.
No, I'm sorry. I should have meant lower socioeconomic class. Lower socioeconomic versus higher socioeconomic. If you just compare those two without the overall average, what is the difference?
Oh, the difference is, and these are roundabout, but roughly, 5.5 months behind for students in high poverty schools versus more like a month and a half to 2 months for students that are in low poverty schools.
But but in a low poverty school, that is a mix of students. That is those children who are both from poorer families as well as those who are richer. It's just that the average is that the students are richer. Were you able to differentiate again between students who come from a census tract of high poverty versus a census tract of low poverty?
In our study, we couldn't differentiate at the individual school level based on poverty.
Okay, let me stop you there because I have limited time. Ms. Wall creates a very compelling case that children with learning disability or disability in general are particularly vulnerable. Did any of your research look at the impact upon children with, now I will go to dyslexia, but just pick learning disability in general versus those who did not have a learning disability?
Again, I don't want to rely on our research, but I've read a lot of research by other researchers, and the answer is that more vulnerable students were clearly made worse off by the pandemic. It's not clear that that's solely about what was going on in the schools. As I think you mentioned in your opening remarks, some of this may be about what was happening in the homes from folks from different backgrounds too.
Did you track in your, we've talked about the 8.1% of children leaving public schools, but we've seen an uptick of about 240,000 of children going into charter schools. And anecdotally, there's been increased enrollment in private and parochial schools. Did your data track the migration of such students?
No, that was not the focus of our work.
And Ms. Tucker, in your experience in Connecticut, have you tracked? I don't know of the fall in enrollment in public schools in Connecticut, but assuming that there was some decrease in enrollment, did you track what percent of those students who are no longer in public school are either in a charter, a private, or a parochial school?
Thank you, Senator, for the question. We have a really robust data system that allows us to do data tracking of our students. Specifically, we've looked to see when we did an assessment in the previous year, basically how students did based on their learning models. We've looked, our enrollments are down. And also now coming back up, and we're able to disaggregate. I don't have those specific numbers for you, but we're able to disaggregate our data, and we're able to tell how all those student groups are performing. And to the point that was made earlier, certainly they were all impacted, or students with disabilities, and I know it's a concern of yours, were disproportionately impacted, why it's an area and a student group that we're working very hard to address those needs.
But specifically, were you able to track whether or not the children who disenrolled from a public school subsequently enrolled in a charter? I don't know if you have charters, assuming that you do, a charter, a private, or a religious school?
I don't have that level of data. I did.
Okay, let me stop you there. Yep. I happen to know that the people who literally wrote the book on dyslexia, Dr. and Dr. Shaywitz, are in Yale. And 1 in 5 children are affected by dyslexia. So I don't know if you screen first. The first part of the question is if you screen for dyslexia, and secondly, do you have specific data as regards how those children did during the kind of remote learning period, subsequent to the remote learning period? Did they fall further behind than their peers, independently of their income level of the family?
So we've looked at the student with disabilities. We can disaggregate. I don't have the information specifically for students identified with dyslexia, but those or students with disabilities in general certainly were disproportionately impacted.
And does Connecticut screen and then subsequently test to confirm if somebody is dyslexic? Do you screen children for dyslexia?
That is occurring. It is an area of concern for us this past session. An Office of Dyslexia and Reading Disabilities was placed by our legislature in our office to really get closer to those issues, to work with also higher education, make sure that our teachers.
Okay, I'm sorry. She's about to rein me in.
Okay.
Can you tell me what % of your students have been identified as dyslexic?
I don't have that specific number for you, but we'll get that to you.
I suspect there'll be a second round, so I yield.